So, greetings everyone. My name is Jean-Pierre Kiekens with Covaxit.com, and I'm extremely honored today to have two distinguished speakers for this webinar. We have Dr. Geert Vanden Bossche, who is from Belgium. He is a doctor in veterinary sciences, but also he holds a PhD and he has a distinguished career in vaccinology. He's a top expert in this field. And we have Dr. McCullough, who is a medical doctor, a master in public health, and has a distinguished career in medicine. And he has become one of the top experts in the world when it comes to the treatment of COVID-19. So welcome, gentlemen.
Thank you.
Thanks for having us.
So this is going to be a content-rich webinar, but let me state right away that none of us have any kind of anti-vaccine perspective. We are all for safe and effective vaccination, and we are also for safe and effective therapies when it comes to COVID-19 and saving lives. We are all independent, free thinkers, free of conflict of interest. And regarding myself, let me clarify, I am not a doctor, but I am a policy analyst, and if I make any kind of statement that is wrong in my presentation regarding to health or virology, gentlemen, please correct me. I think that we have no excuse today in terms of dealing with this pandemic. There has been huge research going on for a year now, and I think there is no excuse for countries not to handle this better. And I'm very pleased that we have a fourth speaker in our presentation. Who is this? Who is this?
That is a four-legged creature immune to COVID-19 so far.
Okay. Well,
So far.
I'm going to start with some introductory remarks, just to put things in context, because I expect this webinar will bring people who don't know much about early outpatient treatment, or conversely, who don't know very much about vaccinology. So I think it's important to put things in context. Then we will have the presentation by Dr. Vanden Bossche, followed by the one by Dr. McCullough, and then we are going to get into a discussion. Okay? Let's start with this slide. I'm introducing you a therapy that, as you can see, reduces by 90% clinical deterioration for COVID-19. I think most of you will never have heard about that therapy, which has been used for months actually in the US. I'm not sure in many other countries, but it's important to know that this kind of therapy exists. And it's a generic drug, it's a prescription drug, but they exist and they can reduce by 90% clinical deterioration. This is nearly or about as effective as the declared effectiveness attributed to vaccination. I'd like to show you another therapy that is even more astounding, and this is just a mouthwash. And that has been demonstrated through a randomized controlled trial out of Bangladesh to reduce by, and you are going to be stunned by the numbers, by 80% the risk of hospitalization and 88% the risk of death. Just a mouthwash to take at first symptoms. Dr. McCullough is going to present us all the complex set of medications that can be used for early outpatient treatment, but just these two tell us a message that this disease, if treated early at the first symptoms, can be dramatically contained in terms of risk of hospitalization and risk of mortality. Another aspect that has been overlooked dramatically is prophylaxis. And this is one of the articles from Covexit.com from June. And vitamin D, zinc, for example, quercetin, vitamin C, important agents that help prevent severe form of the disease. And unfortunately, most of the population is unaware of that because this has not been promoted as a public health message. Prophylaxis also in nursing homes for the very old. And we had several events, webinars with information about this. We even had Dr. Farid working with me to develop this protocol for the prevention and early treatment of COVID-19 in nursing homes. It is incredible that the vast majority of the death in countries like Canada occurred in nursing homes, and no therapeutic or prophylactic means were used to contain the disease, to contain the outbreak, to save lives, while these were already identified back in April with notably the work of Dr. Armstrong in Texas. So the tragedy of the nursing homes is not the only one. We have in front of us another tragedy, which is long COVID. And so you have people who recover from the disease, but not fully. There is a lot of morbidity. You have a lot of lasting symptoms. And you may have heard a lot of attention is being paid to this now. There is going to be a lot of research. But I can tell you one thing. I'm pretty sure that after hundreds of millions of dollars will be spent on research, that they will come with a conclusion: the earlier you treat this disease and you prevent it from becoming advanced and reaching a cytokine storm level, the more likely you are going to avoid the long hauler situation. That alone justifies early outpatient treatment. But in most industrialized countries, and I use the term here of Dr. McCullough, we have used, or these governments have decided to use therapeutic nihilism as the approach to COVID-19. So essentially, during the first 2 weeks of symptoms, stay home, don't take any form of medication that could help you. There are countries that did it differently and that came to the obvious conclusion pretty early on that the disease needs to be treated early and home. And here are some examples of early treatment kits from India, from Brazil, and from Guatemala. And I give you this example here of the Ziverdo kit, which costs, I think, $4 US. This is a combination of zinc, of doxycycline, an antibiotic, and of ivermectin. The full treatment costs $4. This is a treatment that is recommended by an extremely knowledgeable, famous medical doctor, Professor Borudi from Australia. This kind of treatment is mostly prohibited in industrialized countries, certainly in Canada. In the US, there are some form of off-label prescriptions going on. I think in Europe there is no use of this kind of treatment. A country like India has embraced early outpatient treatment. And here is an article, a curve that shows from an article that got published on Covaxit.com, and it shows that millions of patients received either hydroxychloroquine-based therapies or ivermectin-based therapies. And, well, according to these authors, this is the reason why you have much lower mortality in India. If you look at the cumulative confirmed COVID deaths per million globally, you see that the countries, the richest countries typically don't fare well. Now, of course, you have a factor which is very important, which is age, but that's not the only factor. And the countries that have embraced early outpatient therapies typically fare much better. Since April, the debate, I think, was set between existing effective treatment. We know that, for example, Dr. Zelenko in New York was already treating patients very effectively with triple therapy, and his work has been validated by research done by German researchers and himself, showing a dramatic reduction in the need for hospitalization. But at the time, we were already into the quest for the vaccine. And today, clearly, early outpatient treatment has been maybe embraced in several countries, but in the industrialized world, it has been largely sidelined, totally prohibited sometimes, with amazing situations. In Australia, if you have a medication that is available over the counter in most countries, you can go to jail, you see. So you see today there is a push for vaccination. And these are as you can see in the graph, the cumulative vaccination doses per 100 people, with Israel very known to be the country the most kind of advanced in that regard, United Kingdom, United States, but you can see that we are still very, very far away in most countries from the level of vaccination, for example, in Israel. And there are issues with these vaccines, to the point, for example, that several countries have at least temporarily suspended the use of the AstraZeneca vaccine. And there are also supply issues. I think one aspect that is very much overlooked is the effectiveness of these vaccines. There were clinical trials, but now there are some data that are emerging and that show that the actual effectiveness may be much lower with precisely the target group that one wants to save, the most vulnerable, the people in their 70s and 80s. This is a study that came out from England, and it shows actually that people vaccinated still need to hospitalizations. For example, there you have 9.14% of the people with one of the vaccines needing hospitalization versus 15 if not vaccinated. And in terms of mortality, you still have substantial mortality in that age group. These are graphs for people above 80. And this brings me to the key of this pandemic from the very beginning, is that the mortality is very much linked to age. So the older you are, the more likely you have a likelihood of death from this disease, and it's really exponential. It's so the differences are dramatic, and these are data again from the UK, and of course in the UK, let's not forget, you have therapeutic nihilism that is being implemented. So these people, they are not given any kind of treatment before hospitalization. So the most effective treatments are not given in this group of people, and to elaborate this data. So this data could be amazingly improved if there was proper care. Now you can see here another graph, and that is about the US, and you see the level of mortality per age group. And you see that it's extremely small up to age, let's say 45, and then you see it grows. The share of the mortality attributed to COVID-19 grows with age. But it is very, very, very small for people in this particular instance below 45, 55. And another aspect which is worth questioning, because of course the previous graph raises the question, do we need to vaccinate people at extremely low risk of the disease? So do we need to vaccinate people, let's say, below 50 years of age? And then the second aspect that emerges here is this question of reinfection. I checked, and we are nearly worldwide today at 100 million people who have recovered from COVID-19. Do we need to vaccinate these people? I think that's a fair question, because there is an anticipation that we have a protection from the virus if we have recovered from the disease. And there are French researchers, and also from the US, they looked at that, and they looked at cases of reinfections, and they found extremely few cases globally of reinfections. And I think from a policy viewpoint, that raises the question, do we really need to vaccinate people who have already had COVID, knowing that this is the recommendation in most countries? Now, we are going to talk about variants. You may have heard about vaccine resistance, and it's pretty clear that actually all the existing vaccines are not effective vis-à-vis the South African variant. And this is based on science. There is, for example, this article in Nature. Things are getting pretty clear in that regard. And from let's say the policy perspective, at the level of jurisdiction of a jurisdiction, for example, Quebec, what they know that the variants are circulating, they are in the community, including the South African variants, and they are pushing for vaccines that are known not to be effective for that particular variant. But the discussion is well beyond this question of variants, because it is all about green passports now. If you want to return to normal, and you will need to have vaccination, and you need a green pass. This is the situation in Israel. And Israel is a little bit different from other countries in the sense that there is a consideration for a previous infection to get, and a previous case of COVID to get the green pass, from what I understand. But in most situations, the conversation is really, you get your green pass, you get your vaccination passport, a certificate, a vaccine certificate. And this is how today, for example, CEOs of airlines are pushing for a certificate or a passport of vaccination, and the European Union is going to propose a green pass. And many young people, they want to get back to normal. They want to get back to kind of a normal life out of lockdown. Even if they don't need the vaccine, even if they know sometimes they don't need the vaccine, they are going to get vaccinated just to get the green passport, to be able to go to a concert or to take a plane. This is the situation in which people like the CEO from Qantas back in November is putting us. And you will hear from our speakers, and we know very well that people having been vaccinated can still have the disease and can still shed the virus. So it's kind of an illusion to think that air travel will be safe with these vaccination passports. Talking about, I'd like just to put a parenthesis here to have a practical tip, because I did international travel myself, and I really did my homework, I think, about the topic, and I was really wondering, but how the heck am I going to, do I travel, is it safe? And so I heard and I listened to the advice of Professor Marik from the FLCCC, and who is very much behind the mastermind behind this IMAS Plus protocol, which is a prophylaxis and early outpatient protocol. And what did he recommend? N95 mask when you travel by air, because the other masks don't really prevent the virus to get inhaled by you, and ivermectin prophylaxis. And in addition, you take a lot of precautions to avoid contacts, etc. You don't remove your mask for eating, for drinking, etc. And this is probably the safest way, in my opinion, to travel. And I will not trust any form of vaccination passports if I'm told that people with the passport can still have the virus and shed it. I'd like to finish these conclusions, these introductory remarks, with a few excerpts of this interview I did of Professor Clancy from Australia, a retired immunologist, emeritus professor. And he created kind of a scandal in Australia, saying that a molecule like ivermectin or one like hydroxychloroquine was going to be effective at the early stage of the disease. This is something you cannot say in Australia, but he did it. And so he clearly says in his interview that you need both vaccination and early treatment. He also has views about what are the safest vaccines. And if I'm in Canada, for example, I don't have any access to what he considers to be the safest vaccines, which are the classic vaccines in his view, and what he calls 21st century variations of these vaccines, Novavax. So I really invite you to read this interview of Professor Clancy. He has very interesting perspectives. And regarding the vaccination of those who already got COVID-19, his answer is very clear. He considered it scary, stupid, asking for trouble.